March is National Nutrition Month, a time to promote better food choices and healthy eating habits. So to give us more insight on this, we are welcoming the American Heart Association Executive Director Kayla Smith and Covenant Health Cardiologist Dr. Brianna Costello. Thank you, ladies, both so much for joining me on this Monday morning.
Thank you.
Well, first, let's talk about the connection between heart health and nutrition.
So, there is a intimate link between the two. It's the age-old adage, you are what you eat, right?
Right.
So we focus more and more now because we know that there's a cardiometabolic connection, meaning if your metabolic health is poor and you're eating processed foods and you're not getting activity and you're not focusing on the Mediterranean type like diet, so whole grains, lean meats, just whole foods, that is directly linked to worse cardiac outcomes. It's very clear your risk of diabetes goes up, your risk of high blood pressure or your ability to control your blood pressure is harder. So it's just very intimately linked, and we talk about it more and more in the office now compared to back in the day when we focused more on just a reflex treat instead of prevent.
That's a good point. So it was sort of, we were on the back end of it, and now we're really trying to get ahead of it in the medical industry.
That's exactly right.
And let's talk about our 8 essentials. What does that really mean?
Yeah, well, at the American Heart Association, we have something called the Life's Essential 8, and it's really the 8 things that we say you should do if you want to have the healthiest, best life. And so nutrition is a big one of those. It's huge. We also talk about sleep, mental well-being, physical activity, knowing your numbers. So go to your cardiologist. What's your cholesterol, your blood pressure, your blood sugars. Don't smoke. So all of those 8 things kind of all marry together and can make you, if you follow those things, you should be in optimal health.
And do you have any advice for people who are needing to sort of change some of their habits? Because you mentioned a couple of things that are very hard for people to do. Watch our diet, get enough sleep, all the things we complain about. So what do you tell your patients if they come in?
A lot of times I tell patients, you have to make you a priority. So if it's that getting the exercise is hard, you've got to figure out a way to get it into your daily regimen. You have to put it on your schedule or your to-do list. And we're all busy, especially, moms or working parents, working dads. You have to pencil it in, because if you don't pencil it in, it's so easy to brush off. So I say, if it's 20 minutes every morning that you wake up, set your alarm, 20 minutes sooner, go for a walk, or do some activity online that you look up, but do something that focuses on you and your health. If you don't do that and you don't pencil it in, it's very likely you're not going to do it. From the food standpoint, this is a simple thing that I tell patients all the time. If you know something is in your house and you're going to eat it if it's there, you just don't buy it, right?
Yeah.
It's so silly and simple, and I have kids and they like this and that. Well, it's probably just better, don't buy it, don't bring it in. So little small changes in your daily routine, because these are healthy habits. It's a lifestyle. It's not just a diet, right? It's a lifestyle. So you have to make that lifestyle work for you and your family. And, doing something and showing your kids what's healthy is so important. And starting them young is the best way to do it.
Well, certainly we know that we want to encourage people to talk with their doctors, but the American Heart Association also has some resources.
Yeah, I mean, your doctor, obviously, that's the first stop that you want to make, but I know that there's a lot of information out there. Sometimes it's hard to filter through it. The American Heart Association, we are backed in research, science, evidence-based. We have a lot of guidance on our website, so if you're looking for somewhere to start, maybe you've spoken with your doctor and you want to do some of your own research and look into things, go to our website, heart.org. You can find recipes on there. You can find information on cardiac conditions. If you've maybe been diagnosed with something, there's a plethora of information on there. So if you're trying to just say, where do I need to begin, go there first and see if you can find something that might help you.
Lots of good things to think about this morning. Thank you so much, ladies. We appreciate it.
Thank you for having us.